Hey guys, what's up? This is Jordan Crook with TechCrunch, and today we are talking with the founders of StartUp Health. So we have Unity Stokes and Stephen Krine.
Hi, Jordan.
How's it going?
How are you guys?
Great.
Great.
Thank you for coming in. So the first thing is just tell us about StartUp Health. What is this all about?
StartUp Health is an academy for health and wellness entrepreneurship, and it's really around a thesis of wrapping a community around inspiring, educating, and providing resources to healthcare transformers.
So we've seen that in the past, the healthcare industry has actually been notoriously left behind when it comes to innovation. There's really, it's just very backwards, and we don't see a whole lot happening, but that must pose some pretty big challenges for you guys. How do you deal, and what are those challenges?
Yeah, it's really one of the last big sectors to not be completely disrupted. I think we're in the middle of that disruption right now, and one of the reasons for that is the challenges are different in this space. So for example, the sales cycles are very, very long. There's also different types of regulations that can impact your company as you're growing your business. So what we did is sort of put in place a long-term program. It's actually a 36-month program to sort of help the entrepreneurs navigate these challenges along the way. We developed a structured curriculum, and we actually brought the healthcare transformers together in peer groups of sort of 10 people together, 10 entrepreneurs together, so that they can sort of work together, collaborate, and sort of innovate together along the way.
Right. Well, that's cool. So I hear that your model is actually very different from most incubators and accelerators, in that it's free to entrepreneurs. How does this all work? Explain this to me.
Yeah, we thought it was really important to create a free program. One of the theses is really, the more we can do to inspire the best entrepreneurs, the best developers, the best talent, the best designers to sort of come over to the health and wellness sector, the better we'll be as an ecosystem. So we made it a free program for entrepreneurs. The way the business works is we're actually have tuition scholarships, giving full tuition scholarships to these healthcare transformers that are funded by companies and organizations that want to fund and sponsor innovation.
And you actually just brought in a brand new class of healthcare transformers. That's what you call them.
Yep.
And why don't you tell us a little bit about these guys? Where are they? What are they about? And what are some of your most favorite?
Sure. Well, the good news, they're not all guys, so that's
Right.
a good thing. So there's 10 healthcare transformers. 5 are on the East Coast, 5 are on the West Coast, 5 New York City, and 5 West Coast. There's 2 women that are part of that class. There are 5 serial entrepreneurs that have built companies in the past and sold them. One of them is a second-time entrepreneur in this space. The other 4 are first-time entrepreneurs in this space. So a wealth of incredible entrepreneurial experience. There's 1 doctor, there's 1 physical therapist, and 1 PhD, or I guess 2 PhDs. And they're really working on what I think is insights into where things are going in healthcare, which is over the next decade, we really want to try to lower the cost of healthcare and improve outcomes. So each one of these entrepreneurs is working on something that, through their own experience, they realized was a problem that they could solve. And I think that when you look at some of them, and I'll give you a couple of examples of them, and they're all very exciting, but one of them is working on a device that's actually the size of an iPhone that can help a woman who is in a high-risk pregnancy situation get monitored by her doctor from her own home or wherever she might be, and doesn't need to be sitting in a hospital bed to have the full analysis and full report that typically an OBGYN would require.
Right.
This is something that used to cost $25,000. It'll cost under $1,000, and it really can allow a woman to live in, be at home and get monitored by her doctor in that high-risk pregnancy situation. Another startup is working, entrepreneur and his startup is working on really giving a doctor insights into their population of patients to help their patient population be healthier. And it monitors, are the patients going to the labs to get their tests on a regular basis? Are they getting their prescriptions filled on a regular basis? Giving them feedback about how they can look across their population instead of thinking about the paper files that they can't see into. It's really connecting data from the insurance companies and the medical records and the pharmaceutical pharmacies to give these doctors insights that they've never been able to have before.
There's really cool new things too, like Basis, which is a watch that basically sort of measures your vital signs and your heart rate. So we're seeing really cool mobile sort of integrations go on. We're seeing, there's a company called Direct Dermatology and Dr. David Wong, who's basically, you can take a picture of a mole and sort of have it analyzed by doctors remotely. So it's all over the spectrum, and we're just seeing extraordinary innovation happen across the spectrum.
The last thing I'll say about the healthcare transformers and how we look at the space is they're all at various stages of the life cycle of a startup. They're not, in fact, none of them are at the idea phase. They're all at some level already either funded by venture capital, angel capital, or grants, or in several cases profitable. So these are entrepreneurs that are already up and running, but are trying to figure out how to get to that next level, or collaborate with each other to get to that next level. And so we're seeing across the spectrum applications come in for people at the idea phase, which we're happy to help with. But I think the big opportunity in this space, and really over the next decade, is help 1,000 of these healthcare transformers at any stage of development have a step up because of this curriculum, because of the peer support, and because of this kind of program and access to resources.
So how many more classes will you be recruiting in the coming year?
In the coming year, we'll do 15 in the next 18 months. We'll do 3 more this year.
Within 2012?
Within 2012. And
So
we'll do
30 more healthcare transformers invited into the program this year.
Awesome.
And then, yeah, and we'll double that, add on next year. And because it's a 3-year program, this is going to be a network of lots of groups of 10 healthcare transformers.
Well, I think that what you guys are doing is really cool. I know that, social and pictures and gaming, everyone just flocks to what's popular, but I think that it's really cool that you guys are focusing on something that we really need.
It's important.
Yeah, so thank you for coming in. I
Thanks
really
for having us,
appreciate
Jordan.
your time.
Thank you.
And that is it for Startup Health.